guys, this is part 3 of the Nclex-Rn 2018 Comprehensive Review. This is talking about community nursing. Section 1. The nurse's role in community nursing. So the nurse is in charge of community assessment, which basically means a comprehensive assessment of the community. So you're going to look at their biological, social, cultural, physical, environmental factors, financial, etc. of the community. The community nurse is also in charge of the referral. So they're going to link the community with the resources like meal delivery, transportation, mental health, medical equipment, whatever the community needs. You're going to coordinate it. Community nurse could also be a home health nurse, a hospice nurse, school nurse, parish, case manager, etc. You're going to help the vulnerable, the homeless, the poor, substance abusers, etc., pregnant people, etc. Section 2. Disaster planning. A disaster is a disruption of the function of the community that causes widespread losses that the community can't handle with its own resources. Two different types of disasters is internal disaster and external disaster. Internal disaster is events that happen in the healthcare facility that threaten to disturb the care. Examples are structural, which could be fire, no power, or personnel, which staff goes on strike or everyone's absent, etc. And external disaster is events outside the healthcare facility, like human-made disasters, which is like bioterrorism, bombs, transportation, structural fires, etc. Or it could be a natural disaster, like extreme weather conditions like blizzard, tornado, earthquake. Or it could be both. It could be from an external disaster, like a weather condition. It causes internal disaster, people not able to get to work. You want the nurse to prevent disaster, to reduce the risks, like you want to improve security, protect the building, public health awareness, etc. Disaster preparedness occurs at a national, state, and local levels. You need the community involved to prepare for emergencies, etc., like shelters, plans, emergency systems. So the role of the nurse. The nurse in the healthcare facility is going to train the personnel and disaster drills at least twice a year, tell you why you would activate the drill, etc. And the nurse in the community is going to educate the families on disaster planning, which includes what to do in case of a disaster, how to evacuate, plans for the pets, where to meet in case of emergency, etc. A disaster family kit should include flashlights with extra batteries, battery-powered radio, non-perishable foods that don't need cooking, 1 gallon of water per person, basic first aid supplies. You want the mattress to be in a waterproof container. You want household liquid bleach. You want blankets, pillows, sleeping bags, rain gear, clothing, sturdy footwear, medication, toiletries, documents, and money. The nurse is in charge of assessing the community for risk. Disaster response. So you have the emergency response systems like 911, which has the first responders that come. You have disaster relief organizations like FEMA, the Federal Emergency Management Agency, that manage the federal response and recovery efforts. You have the American Red Cross, which is to provide disaster reliefs like shelter, food, etc. You have HAZMA, Hazardous Material Response Team, that if you have a hazardous material, they'll come and they're trained and they decontaminate it. And you have other stuff like CDC, etc. Okay, so the role of the nurse. So the nurse is in charge of triage, which is basically, triage means prioritizing which patient should receive care first. So you have two different types of situations. You have a non-mass casualty situation and a mass casualty situation. So a non-mass casualty means that you have a ton of people who need care, but everyone could be cared for. A mass casualty means that you have a lot of people, but you can't treat everyone. You don't have enough staff, or etc. So which ones do you do first if you could treat everyone, which is a non-mass casualty? So there are 3 levels that you go according to these levels. There's emergent, urgent, and non-urgent. Emergent is immediate threat to life, like the critically ill, etc. And then you go on to the urgent, which is the major injuries that require immediate treatment. Then you go on to non-urgent, which is the minor injuries. For a mass casualty, which you have a lot of people but you can't get to treat everyone, the rule is that you want to provide the greatest good for the greatest amount of people. For example, if someone's about to die, you're not going to treat them because they're going to die, and then you're not going to treat the other person who could have lived. So you go according to these steps. So first you go according to class A, which is emergent, which is given the color red. They are immediate threat to life. Do not delay treatment with them, like airway obstruction. They require immediate attention, shocks. Then you have urgent, which is class 2, which color is yellow. They're major injuries that require treatment. You could delay them only 30 minutes to 2 hours, like an open fracture with pulse in extremities, etc. Then you have non-urgent, which is class 3, which is green. They're minor injuries that do not require immediate treatment. You could delay them 2 hours to 4 hours, like if someone's wounded but they're walking around, a closed fracture, a contusion. Then you have expectant, which is class 4, which is black, that they're expected and allowed to die. You should prepare for the morgue for them. It's someone with a massive head trauma, cardiac arrest, etc. Then we're going to go on to disaster recovery. So just keep in mind PTSD, post-traumatic stress disorder, which could develop after trauma. You should know it could develop weeks, months, even years after. You want to have a debriefment with the healthcare professionals and the first responders that were there and discuss your feelings and what you could have done better. Then we go on to bioterrorism. So just quickly, there's 3 categories, A, B, and C. Category A is the highest priority and threat because it's easily transmitted and a high mortality rate, like smallpox, botulism, anthrax, Ebola, plague, etc. And then you have category B, which is second to highest priority, which is moderately easy to go around and moderate morbidity and mortality, like typhus fever, E. coli, West Nile virus. And then you have category C, which is lowest priority, that it's emerging pathogen that could cause mass dissemination. So it has a potential for high morbidity and mortality, but we haven't seen it yet, like influenza virus, rabies virus, etc. Section 3, culturally competent care. So the nurse is in charge of assessing to identify the values and beliefs of the patient. We want to know if they use herbs, traditional medication, what is important to them, if they understand English, their diet, family, etc. You want to remain sensitive even if you don't believe in what they do. You want to get a trained, and not family, bilingual interpreter. You want to give them the correct diet. You want to involve the family if that's what they want. Be respectful. If they don't like eye contact, try not to use that a lot. You want to check the herbs to see if they interfere with the medication. And also remember that spirituality may not necessarily include religion. So now we're going to go over the different cultures. First, we're going to start off with African Americans. African Americans are into their church. Their religion is very important. Most of them are Christian or Muslim. A mental illness could be viewed as a lack of spiritual balance, and they believe that God's will was chronic illness and etc. So when it comes to labor and delivery, they like to do self-treatment for discomfort. They like emotional support, usually by a woman, usually the mother's there. In regards to the death, the deceased is highly respected. They do organ donations and autopsy. So direct eye contact is considered rude. They touch, they hug, they're very close. Very often the grandparents are in charge of caring for their grandchildren. They could have the mother in charge, extended family, the father might not be there, nuclear family, however. So they first use home remedies first, and then they come to the doctor. Sometimes the mother knows the home remedies from her mother, etc. They usually like prayers for the minister. They have a mistrust for medical establishment, which is why they use the home remedies first. So their health risks. If you have a question, the risk factor, and they live African American for any of these, and you click on that. Their health risks are hypertension, coronary artery disease, sickle cell anemia, prostate, breast, colorectal cancer, renal disease, and diabetes. So next we're going to go on to Asia. So that includes Chinese, Japanese, Korean, etc. So their spirituality is Christian, Hindu, Buddhism. They believe in yin and yang, that illness is caused by an imbalance of that. And they believe in this viral energy called cha. Maybe I'm mispronouncing it. In terms of the births, they have a female family member by the bedside. It's very normal to breastfeed. If there's a genetic defect, it's blamed on something the mother did during its pregnancy. A new mom eats a special diet and remains at home. Okay, so when it comes to their diets, so certain foods are considered hot and cold. So some hot foods are chili, ginger, animal products, and cold foods are milk products, yogurt, sour foods, and vegetables. In pregnancy, it's a hot state and they don't eat cold food. They believe that hot foods could cause miscarriage, fetal abnormalities, etc. And food is critical for the yin and yang balance in the body. So the yin is the cold, the yang is the hot. And it has to be a balance in the body. So eye contact is avoided with authorities because it's a sign of disrespect. They're very into being punctuality and being on time. They dress modest, they don't display affection, the head is very scarce, so they don't touch someone on the head. It's usually run by the husbands, and the wives become part of the husband's family. They may nod even if they're in pain, so you ask them what's their pain and they rate it on the scale. You don't just go by looking. They generally use traditions and herbs, etc. Health is achieved by the balance of the yin and yang, like the cold and hot, like we said before. So their health risks are hypertension, stomach, cervical, and liver cancer, osteoporosis, thalassemia, anemia, and tuberculosis. Okay, now we go on to Hispanic and Latinos, which is Mexicans, Cubans, Central America, Spanish, Puerto Rico, etc. So they're generally very religious, Catholic and Christian, health is controlled by fate, they're into the will of God, etc. So during birth, usually a female is present, they breastfeed, a new mom eats a special diet for the first 2 days, like boiled milk, toasted tortillas, and remains on bed rest for 3 days. With death, they don't like leaving the patient alone, so because the body is respected, so there will always be a family member there. They don't do organ donation or autopsy. A pregnant woman will not attend the funeral. So for the diet, they like to eat fresh vegetables, beans, rice, fried fruit, etc. They generally speak Spanish and English. Handshaking is considered polite, but to be touched by a stranger is inappropriate. But their friends and family, they embrace each other and touch each other, but not by a stranger. They're very into family. Family comes first. They're loyal to family. When someone's sick, they resume a passive role. They're very into soups, herbal tea to speed healing process. They could seek medical treatment for very severe symptoms, but otherwise they're going to use traditional folk healing measures. They also go according to the hot and cold theory of illness and pregnancy. Their health risks are childhood obesity, hypertension, vitamin B12 deficiency, anemia, and diabetes. So next we go on to Native Americans, which has more than like 500 tribes, and they each have their own beliefs, but in general they believe in a creator, and they have scared myths and legends that provide spiritual guidance. They generally follow their tribe. Illnesses is from living not in harmony or being out of balance with nature. By birth, the female is present. They don't believe in organ donations and autopsy. They speak English. The mom could be the head of the house. When they're sick, they're quiet and stoic. Healing, they go to modern medicine and traditional. They use herb. A lot of them wear a medication. It's like a bag around the neck, and it contains something scarce. You want to ask them what it is, and you want to try not to remove it. Last but not least is religious practices. I'm not going to go over every religion because there's a lot of them, but I'm going to go over the few main ones. So Buddhism. So they believe in reincarnation. The monk delivers the last rites by death. Most of them practice a vegetarian diet. They avoid alcohol. They like a quiet, peaceful environment so they could pray and practice meditation, etc. And they may refuse care on holy days. And then we go on to Hinduism. So they prohibit abortion. Child is not named until the 10th day of life, so that doesn't mean that the mom is depressed. It means that that's their religion. They believe in reincarnation. They allow a natural death. The client may want to lie on the floor while dying. Thread is placed around their neck and wrist. They also do vegetarian diet. Most of them abstain from beef and pork. The right hand is used for eating and the left hand is used for toileting and hygiene. For several days a year, they set aside for fasting. They're very into personal hygiene. Then we go on to Islam, which is Muslim. So when the baby's born, they say a prayer in the baby's ear. Many patients confess their sins before dying. A dying patient may want to be placed towards Mecca, which is usually east. After a death, they do traditional bathings with burial within 24 hours. So this is like main thing you should know: the food must be halal. That's what they're very strict on. They cannot eat pork, gelatin, alcohol, and animals with fangs. You should also know the Ramadan is a period of fasting during the 9th lunar month. The patient may wish to pray up to 5 times a day facing Mecca and may have a prayer rug. They're very into privacy when they pray. The women are very modest and they wear clothing that cover the entire body. And the woman may refuse to be cared for by a male healthcare worker. And last but not least, we go on to Judaism. So when they're born, the male has something called a bris, which is performed on the 8th day, which is a circumcision. By the time of death, they do a ritual bathing and burial within 24 hours. When it comes to diet, the food has to be kosher, which means that milk and meat cannot be served together and that cannot be at the same meal or prepared on the same dish. They're very strict on that. They generally sell foods that are kosher or have OU. They do not eat pork or shellfish. They fast on Yom Kippur. That's a requirement. A lot of them are lactose intolerant, especially if they're from a European origin. So their practice is that when it comes to saving life, it overrides all religious obligations. They pray for the well-being of the sick, and anything that could be done to ease the patient's suffering is encouraged. And during the Sabbath, which is every week, the Orthodox Jews refrain from using electrical appliances, like they cannot turn on light, they won't be able to use the call bell, etc.